and welcome to Boston Children's Hospital Winter Wellness Webinar. We are so glad you could join us today. My name is Kristin, and I'm the Director of Enterprise Communications at Boston Children's, and I'm happy to serve as our moderator for today. Before we get started, just a few quick housekeeping items. This webinar is being recorded, and it will be available for future viewing and sharing. So we know that everyone's juggling multiple things. So if there are, any points you need to drop off, but you're really keen to come back, this will be recorded and available for you. We know you may have a lot of questions, and we'll do our best to answer them all. But if we can't get to them today, not to worry. We always share a lot of information and education on many of these topics. So if you do have any questions, be sure to submit it in the Q&A box, but at the end of the webinar, we'll share our website, which you can also bookmark as your go-to resource for all things kids' health. We are so lucky to have these two incredible expert panelists with us to help guide this discussion. I think both of whom you might already recognize as they have appeared many times for us on WCVB TV's Boston's ABC affiliate, as expert resources and here in past webinars. So to help guide our discussion, I'd like each just to take a quick moment to introduce themselves, and let's get started with Dr. Kristin Moffitt.
Hi, thank you so much for having me here today. I am a physician here at Boston Children's in infectious diseases, and I also do a fair amount of research on various infectious diseases, including both bacterial and viral infections, including some COVID-19 related research.
Excellent. Thank you. Dr. Erica Lee.
Hi, everyone. Welcome. Nice to see all of our lovely folks here from BCH, and welcome those of you who are joining us virtually. So I'm Dr. Erica Lee. I am a clinical child psychologist here in our outpatient psychiatry service here at Boston Children's. It's a pleasure to be here.
Thank you so much. So Dr. Lee, let's get started. It has been an especially gloomy January. I have two teenage daughters who I'm often noticing now are feeling a little like less motivated and a little blah. So could you kick us off today and just help us understand like the general term like winter blues, or as it's defined as seasonal affective disorder?
Yeah, this is a great question. I'm happy to give a little bit of context because I think folks sometimes toss around this term, but we're not exactly sure what it means. So seasonal affective disorder is basically when you experience episodes of actual major depression. So what we would actually clinically diagnose as meeting criteria for depression, but it occurs with a seasonal pattern. So you start to see kind of in the late fall and the winter, really after daylight savings time shifts. So when the days get shorter and grayer, kind of like today, kids and adults, this happens to adults too, but you might start to notice your kids becoming more depressed, right? They're having a harder time, they have less energy, their mood is lower, they're not interested in their usual activities, maybe you notice they're thinking more negatively. But this does have a seasonal pattern. So what we notice specifically with seasonal affective disorder is that these symptoms then resolve in the spring and the summer, again, when the days are longer, when the sun comes out for longer. So you're really looking for these kind of patterns that correspond to the seasons and to the weather. Scientists don't really understand exactly why this happens. We think what we kind of understand now is it probably has something to do with the body's reaction to changes in your natural biological 24-hour rhythm, right? Your circadian rhythm that happen, again, unfortunately, that sort of coincide with daylight savings time, right? So your sleep kind of gets off, maybe you're not getting enough vitamin D, your brain may not be producing enough of serotonin, which is, a neurotransmitter that makes us feel better. And so that's what we think may be going on. And folks should also know that, who's at a higher risk for developing maybe seasonal affective, episodes of depression. So anybody who has a history of depression, either in your family or maybe your child or your teenager themselves. If you have a family history of seasonal affective disorder, if you live further north, unfortunately, that includes some of us, the further you are from the equator, and rates also seem to be higher in females. And so, just kind of going back to like, what are we looking for? We're really talking about these winter blues, but actually specifically thinking of it from a seasonal affective disorder kind of pattern is, again, when the sun starts to become lower, we have less sunlight during the day, you're noticing low mood, I always remind parents that like depression in kids can often look like irritability. So they're more impatient, they're cranky. I mean, kids and especially teenagers are already sort of cranky to begin with, but you're really noticing there's a shorter fuse. They really just kind of don't have a lot of patience for anything. They're more tired. Maybe they're a lot sleepier than usual. They're not as interested in their usual activities. Maybe they're having a harder time with like friends, not wanting to see friends. They can't concentrate in school. And again, if you're noticing more sort of negative thinking, or even for some of our kids who experience it in a more severe way, they may be sort of, wishing maybe it'd be better if I was dead, if I wasn't here. Maybe they're trying to harm themselves. These are all warning signs to look out for where you probably want to get some more support.
Yeah, no doubt. Are there some things that parents can potentially put into practice, or what they can do to help maybe mitigate some of this, this depression, this seasonal depression?
Right, great question. So I always encourage families first, just like open the conversation. And I know this is something, especially for our parents of teens, that we might struggle with. Of like, I asked my child how they're doing or how their day was, and I get a one-word answer, or they don't want to talk to me about it. They immediately want to go into their room and like talk to their friends. And they don't want to be bothered. But really, like keeping the conversation kind of open in your family around like, how are we doing, or just acknowledging and normalizing, like everyone, myself included, like when the days get grayer, again, like today, when it's gloomy, when there's a lot of snow, we're not getting as much sunshine, it has an impact on most people's moods. So just sort of normalizing that. Like, I've noticed I'm feeling a little bit more sluggish. Like, how have you been doing as the season's been changing or after daylight savings time? And then for those families where you are noticing a sort of a seasonal, pattern to your child's depression, there's a few things that we recommend. So one is something that we call light therapy. So this is really just increasing your actual access to either natural light as much as possible, or even just like simulated natural light. And it's especially helpful in the morning. So, you can Google this. I think there's even Boston Children's may even have some web pages that have some resources about this. But really what folks recommend is sort of like first thing in the morning, right? So like right when you wake up, trying to get as much natural light as possible. So getting outside is great. But even if you can get one of these light boxes that they sell, it sort of increases the amount of like sunshine that you get during the day. And I also know some families that I've worked with have found it really helpful that really actually in the fall, even like in October, before daylight savings kicks in, when you're already starting to see things are getting colder and grayer and there's less sunlight, you can actually start using some of these. And they have like alarm clocks that will kind of wake you up again with more of this like simulated natural light that a lot of families find helpful. And then, for those kids where they really get stuck, or you notice that like they're more anxious, they're more depressed, like their thoughts are really negative, a short course of cognitive behavioral therapy can be really helpful. So this is our gold standard treatment type of psychotherapy for kids with depression and anxiety that really targets one of those negative thoughts that make you feel more sad or make you feel more anxious. And then the last thing I would say is that exercise reliably helps with depression of any kind. And I know it's harder, especially when you have less energy, you're feeling more lethargic and unmotivated because it's so gray and it's kind of cold or slushy outside, but trying to get your kids up, getting them moving, and when you can, making it a family activity, all of that in addition to healthy diet and sleep is going to be kind of essential anyway to improving our mental health, but it's especially helpful if you've got a kiddo with seasonal affective disorder.
Yeah, I was just going to say that I often say that to my girls, which is, I know it's tough to get going, but on an exercise, but then you always you feel better after, once you've been able to do it. Do you have any suggestions, like looking at various age groups, maybe some activities that parents can maybe sneak in there so it doesn't maybe feel like, oh, it's an actual exercise, but like sneaking something in, maybe like one of those trampoline parks. I'm just making it up, but
yeah, absolutely. The trampoline parks are a big hit if you can get to one, because I know they're not like really frequent, and if you can afford it, I know that a lot of like, kids are really into those. Or those like American Ninja Warrior gyms, like a lot of kids are like that because they're very physical. But even something like, we're just going to go take a walk, we're going to walk the dog together. Like normally, like one of the parents walks the dog because of course the kid wants the dog and then they're never going to walk it. This becomes the parent's burden, but like we're going to walk the dog together, right? Or on these days where it is snowy, like let's go outside and just like like go sledding, play in the snow, like throw snowballs at each other. Like you can kind of try to use the weather in that way, to your advantage. I often say to families too, like just thinking about this exercise piece and your great question of like, oh, if it feels like too much effort, like even just getting a kid to say, you know what, we're not even going to walk that much. We're just going to walk to the end of the block. Like, I just really want you to come. I want to talk to you. Like, we're just going to walk to the end of the block. Because most kids, they get to the end of the block, it's taken like 3 minutes. And then like, I guess I could walk another block, and I guess I could walk another block. And then we can kind of walk around our neighborhood a little bit. But like you said, just getting kids moving is really important. And in terms of indoor activities, a lot of families ask me this as well, of like, well, what do I do if it is really gross outside? Or like, I don't want to go outside. So yes, we've let the dog out in the yard, but like, I don't want to go for a walk, or no one really, it's, maybe it's not safe to go outside. Is again, being creative is like, okay, there's a lot of, YouTube channels now that can get kids moving that people really, really love. And so I think that's another way to think about it. Like Go Noodle, I know, is one that people like. I know there's one called Cosmic Yoga that families like, that again are geared specifically towards kids and families, and are actually meant to be, accessible to anybody. So you don't have to be like, a yoga expert. You don't have to be super physical, but you can actually just get yourself moving at home, so that kids aren't kind of going without that extra serotonin boost that comes from regular exercise.
Yeah, that's really, really helpful. And that's a great segue into some of those outdoor activities. And Dr. Moffitt just talking a little bit about, getting outside. We do live in, the Northeast. Weather is very unpredictable. What do you suggest in terms of like how should kids be dressed for like these various outdoor winter activities? It can sometimes be very hard depending on the age, right? And getting them to dress appropriately. But do you have some suggestions on how these kids should really be dressed for a lot of these activities?
Yeah, no, I think it's a great question. And I think a lot of it, as you said, really is going to be very age dependent. If a child is younger and we're still helping them get dressed and helping them make wise choices about what they should be wearing based on the weather, it's a little bit easier. It's when you get into the school-aged and the teenager age children who maybe have very strong opinions about what it is that they'd like to be wearing, that you would like them to put on something more than a t-shirt and shorts to go out for a walk in the snow. So I think that having conversations with them about common sense, and I always try and frame it with my own teenage children, for example, getting wet feet is going to be just the beginning of the end for whatever activity it is that they are planning on doing. And I know it sounds simple, but we start there. And even having does not have to be a fancy pair, but something waterproof that they can wear on their feet. If they are going to be headed outside, my son was headed out to play on a field over at one of our public schools the other day, and we'd had like rainy snow for 4 hours beforehand, and it finally had cleared up, and he had Crocs on his feet. And I just made the point that that's ridiculous. Your feet are going to be wet in 20 seconds flat, and as soon as they're wet, they're going to be freezing. And especially if it's still cold out, the possibility of something like frostbite is real. So starting with dry feet, I know it sounds simple, but in some ways I've decided to choose my battles, as a lot of us do as parents. So we try and start there, and just make sure that there's something waterproof that they can wear on their feet, and start with dry socks, knowing that they're going to come home with soaking wet feet and wet socks, but at least gets them out there a little bit longer. When it comes to thinking about like layers and the number of layers, again, this is going to be very age dependent. I feel like it's a win if I can get my teenagers to even have on maybe a long sleeve layer and a sweatshirt if we're going to go out and it's in the 30s. If it's in the 30s and it's sunny out and they're at least going to be moving around, they will self-regulate. Are they wearing enough clothing? Probably not. But they will self-regulate. And when they're starting to get cold, they'll let us know. They'll head back to the car. They'll head back to the house. It's younger kids that I remember when my kids were smaller, having this tendency to like really, really, really bundle them up. And I completely appreciate that. Really, really young kids, that is important because they are losing more surface heat to the environment, especially if they're out and they're exposed to very cold temperatures. But if they are kids who are mobile and, they're toddler age or above and not quite making their own decisions yet about what they're wearing, then making sure that they think about the amount of temperature control and amount of clothing that you would like to have on yourself, and kind of take it from there. My guidelines as a pediatrician are for infants, thinking about whatever environment an infant is in, what layer of clothing, what degree of layers would you be comfortable in? This is indoors or outdoors. And for an infant, adding one more layer beyond that. So when they start to move into toddlerhood they're a bit less susceptible to those extreme temperatures. And you can start to think about putting them in a number of layers that's similar to what you would be warm and comfortable in. Hats in really cold weather, gloves in really cold weather would be really important. Those are big sources of where we lose a lot of heat. So if you have a child who's at an age where they're still amenable to wearing whatever it is that you recommend or put on them, that would be important too. But beyond that, those basic guidelines around what would you realistically feel warm in headed out into cold weather is probably pretty appropriate for what your child should be wearing.
Yeah, no, that makes sense. Do you have any guidance on, because there's a little bit of winter left. We're slowly making our way to February. But do you have any guidance on, and perhaps this is just maybe even just for the little kiddos, in terms of, based on degrees, how long should kids be outside for one period of time? And, I'm thinking in various degrees, you were talking about like 30 degrees or above 30 or even like below, do you have any suggestions on when maybe it's a good time to come in and warm up and then go back out?
Yeah, it's a great question. And it's dependent on not just the temperature, but we hear this on the news if we watch weather on the news a lot, is that feels like temperature, because wind chill is a big issue when it comes to risks for things like frostbite as well. And you will hear that from meteorologists in New England in particular. And you'll hear weather described as a feels like temperature. And that usually takes into account wind chill when we have weather where wind is a big factor. And it may be that a thermometer is going to read 30 degrees, but with high winds and wind chill, the feels like will be more like in the teens. So you'd want to keep that in mind if you notice that it's really windy out, or if you've got a weather app and you can tell that it's really windy out. And in that scenario, if it's something under, if that feels like temperature is really under 30 degrees, say it's maybe between like 15 and 30, I think something on the order of 20 to 30 minutes outside, and then coming in if you're noticing on yourself, for example, a feeling on the exposed parts of your skin that is starting to feel even close to like a little bit numb or anything like that, it's time to head inside. And really small kids might be a little bit more susceptible to that. So you may want to, with those colder temperatures, especially kind of 20 or below, I would probably keep those outings fairly short, on the order of 15 to 20 minutes, with ideally really good coverage on, coming in for a chance to warm up. And maybe those are the days in which you're getting out for a couple of outings, but they're shorter ones instead of one longer outing outside.
Okay. Now, so for coming inside, I know for my two teenagers, screens, there's a lot of screen time. And I know we're all, using screens. So Dr. Lee, I just want to talk a little bit about screen time. And I know this is such a hard question, but I feel like it's a question that is everywhere right now, and so many people are talking about it. Is there a limit to how much screen time my child should have every day? And I think it's probably depends on age, right? Like my two teenagers in high school are using screens to do homework and interact and do projects and things like that. But a little bit, if you could just weigh in on, that sort of everyday screen time.
Yeah, it's a great question. And it's one that I hear from almost every family that I've worked with for many, many years.
Yeah.
Screens and technology are only becoming a more kind of integrated part of our daily lives. And I think it's so interesting now for kids, even like our very littlest ones who are growing up now, screens are just a part of their everyday experience, so this is something that's kind of evolving with each generation. And so it's a really great question. And I think you make a great point, Kristin, that one of the things that's hard is, well, what are we supposed to do if, my kid needs screens? My kid needs screens in order to do their homework. My kid needs screens in order to call me. My kid needs screens in order also to like talk to their friends or listen to music or, all of these different things, remote learning. There's all these ways in which screens are kind of integrated. And what I would say is it does really depend on the developmental age, but also just like the stage of your child, right? Because some kids who are 8 are not the same as other kids who are 8, right? Sort of what do they understand about screens? How are they using screens? How much are parents monitoring what's happening with screens? So I think, obviously when the younger your child is, the less screen time your child should have, is actually sort of what we think of as like receptive screen time. So where a child's just sitting there in front of a screen and like kind of taking content in, because it's very stimulating for the brain. As a child and teenagers, as their brains are developing, they kind of can't make sense of this information in the same way. And so it really is a conversation within your family about what I often encourage just for balance, right? Is that everyone's going to have some screen time, and families will also vary in terms of how much screen time they're comfortable with a child or a teenager having. But I often think of it as like, are they giving up other activities, especially activities that are really important for screen time? So for example, are they not spending any time with their family? Are they laying in bed all day? Are they not wanting to go to sort of sports or exercise? We've been talking about getting that physical activity in. Is it keeping them up so late at night? They're not getting enough sleep, so they can't concentrate in school, or they don't want to go to school the next day, or they're not doing well in their classes. And one of the great resources that we have, I mean, we have many wonderful experts here at Children's, but we have a digital wellness lab that's led by Dr. Michael Rich, who's been doing some wonderful research for years and years now, and sort of understanding the ways that kids and teens and families interact with technology, and kind of understanding what does the evidence tell us about best practices. And I always refer to his website. They've got the digital wellness lab has a wonderful website, and they have a sort of a family digital wellness guide that kind of goes through, okay, what does the science tell us about where your child's brain is at different ages, and how does that impact their ability to use technology and to use it appropriately and safely? And then here are some factors that your family should be thinking through in terms of like how much screen time, what kind of screen time. Here are some really great tips for families thinking about like what conversations should you be having with your children, because especially when they're younger and even teenagers, parents, the best practice really is that parents should be doing at least some monitoring of like, what is your child using a screen for? Is it actually starting to become a replacement for real life interpersonal interactions? Are there things that actually, when they're not on a screen, now they're getting nervous because they only know how to do it remotely or on a screen and virtually? So there's some really, really great tips. So I always refer families directly to the expert, Dr. Rich, and his wonderful labs research. There's some really great resources on his site that families can find.
Yeah, no, I agree. It's an excellent resource. And you raise so many interesting points too, because there is some value in some of the screen time, and I understand that. And it's like very, very different from when we were growing up versus, but I do think it's important what you said about, is it getting in the way of other activities, which I think is key here, which is, exercise, interacting with other kids face to face, interacting with family members, things like that. Are there some examples you might be able to share about how a family may approach, and maybe this is also with the digital wellness lab, but if they're really seeing this as a problem and it's becoming a big problem and it's affecting sleep, it's affecting mood, what are one or two things where can families start if they're noticing this is becoming a problem?
Yeah, that's a fantastic question. I appreciate you raising it, right? So, I often say just starting first with conversation, right? Because a lot of times kids will say like, well, my friend, it's often our friends, right? My friend's parents kind of let them have the phone, or why are you taking the phone at night? Like a lot of times I know of many families now will take their teenagers' phone so they can't have access to them overnight because they know they'll just stay up in it till 2 or 3 in the morning and like, on TikTok or talking to their friends, whatever it is. And so a lot of families will sort of take the phone away, and then kids will say, well, it's not fair because my friends' parents let them kind of do whatever they want, and they don't have kind of monitor unlimited screen time. So talking with kids first just about what is it that you want to use your screens for, or what is it that you feel like you could only get from your screens? And again, just sort of noticing like, a lot of times kids will say to me, Dr. Lee, like, I just always want to be on my screens. Like I want to be on YouTube, I want to be on Netflix, I want to be texting or listening to music or whatever it is. But they themselves often also recognize, in addition to parents, that it makes them crankier, more impatient, that they just like actually don't feel better, even though they're spending all this much time doing something that they think that they really enjoy. And it's because there is some aspects of technology that are addictive, right? So again, talking to your kids about what are you actually getting out of it and what are you maybe giving up because you're spending so much time on screens. And again, we want you to have some balance. So we're not saying that you can't have screens at all, but these are the things that are most important to our family. So for example, for our family, like we don't have screens at dinner time. And this holds for parents too, because parents also have to model. We're also, I think adults are often also addicted to our screens because now our phones are mini computers or email devices. Like we use them for so many things beyond what they were originally intended for, which was just to call people and receive calls. And so we also need to model those behaviors. But for example, maybe we say like when we're having a mealtime, like nobody has access to screens. And like, let's actually get back to what it means to interact with each other and not just have a 5-minute meal where someone's maybe looking at a screen for part of the time and then everyone's off and back to their screens. So you can also set some of those modeling behaviors are really important. But again, talking with your kids, what is it that you're getting from screens? What is it that you want from screens? What are you maybe missing out from? Because for a lot of kids, and I've heard Dr. Rich speak really eloquently to this before, for a lot of kids now, they start actually to confuse real life interactions with virtual interactions. They actually feel the same to them. Some of his research has found, that kids don't distinguish between those, right? So they think like, oh, if I'm texting with you and it feels like we're getting really close and we have a really close relationship, maybe I actually never meet you in person, or I actually don't even prefer to see you in person. And I actually think that that's equivalent to having in-person interaction, but it's not, right? Because we know that there's so much more that kids have to navigate and sort of cognitively maneuver when they're talking to somebody in person. And so those interactions can actually become harder when we're solely relying or mostly relying on virtual interaction. So again, thinking with your kids, what are we maybe missing out on? And we want you to have some balance. Here's some suggestions from us about ways we can create balance. What are ways that you're willing to commit to have balance? And for those kids, I think you were kind of hinting at this too, Kristin, for those kids who really are, kind of showing signs of what we call like problematic interactive media use, you want to be thinking about coming to the center here at Children's, or if there's something near you, wherever you are in the country, and speaking to experts like Dr. Rich, who, are experts at diagnosing these kinds of conditions, and then coming up with a treatment plan that works for your family. But again, there's some really nice resources on his website and on Boston Children's websites to better understand digital media use and what happens when it becomes problematic.
Yeah, no, he is terrific, and the center is terrific. And like you said, the approach isn't just approaching it with this is the child's problem or the teenager's problem. He really does address it more as like a family. This is because it does affect everybody, right? So I agree. I would absolutely recommend the Center for Digital Wellness. In terms of, this is a great segue just in terms of wellness and balance. And part of that is I feel like nutrition can go off a little track in the winter months, especially when you come off of like Thanksgiving and the holidays, and then you ease into like January, and it's, a lot of people are spending more time like Netflix and chilling or sitting. So Dr. Moffitt, I would love just to spend a little bit of time talking with you about, nutrition in general. Like, what are some, recommendations from you on how we can maybe, sneak more vegetables in there or get kids more on board with eating a little bit more, healthy? What does that look like? And also what are some vitamins or important elements that we should weave into, the nutritional plan, especially in the winter months?
Yeah, no, it's a great question. I think we all struggle with this when, for example, the produce that we see in the grocery store really starts to turn from almost boundless types of produce and fresh fruit and things during summertime and early fall into much more limited selection. And it can be tricky, but there still are a lot of options that are still grown throughout the world and available in the produce section of most of our grocery stores that allow us to hopefully continue to offer a balanced variety of foods to children. And really, for the most part, it will still keep your child very much on target with what they need for recommended daily allowances of vitamins, for example. So I know that we miss out on some of the pitted fruits and things like that that are so delicious during the summertime and the warmer months. But there still are so many things like grapes and bell peppers and some of the berries that remain available. Oranges seem to be much more available year round now than I feel like they used to be. And continuing to take advantage of what is available that you know your child will enjoy in terms of fruits and vegetables to get them some of those critical vitamins would be really important. And a lot of that, just as it is true with screen time, comes from modeling as well. So our children are paying attention to what we're eating too. So I think that making those things not just available and offering those things to your children, but really making the commitment yourself to include a very varied diet of produce in particular would be an important model for your children to have to follow. The one vitamin that particularly in latitudes such as ours here in New England that can become an issue in the winter is vitamin D. And that's because vitamin D, while there are some natural food sources of vitamin D, such as oily fish and egg yolks and things like that, the natural food sources of activated vitamin D are not typically things that children really enjoy. Vitamin D, most of what we get for vitamin D, we actually get through exposure to sunlight. And the sunlight activates vitamin D through our skin. And if we have a relatively short period of exposure to sunlight during almost all of the months of the year, except for maybe in December, January, February, we're probably getting enough vitamin D just from that sunlight exposure to meet our daily needs. But there's very good research that demonstrates that for adults and children who live in certain latitudes where the days are shorter and the strength of the sun is much more limited, that there are significant decreases in vitamin D, circulating vitamin D during those kind of shorter days in winter months. So vitamin D can also be found. Almost all dairy products now, particularly milk, is fortified with vitamin D. So I would just be reading labels in terms of making sure that the dairy products that you're getting for your family are fortified with vitamin D if possible. There are some grains and cereals that are fortified with vitamin D and other vitamins and minerals as well. If you have a particularly either a very picky eater or a child with various food allergies or lactose intolerance, such that you really don't have a lot of options from some of the foods I just mentioned in terms of sourcing vitamin D for your child during those winter months, that's when you might want to consider supplementation. And in that scenario, I think probably almost all of the children's vitamins that are available do provide at least the recommended daily allowance of vitamin D. So those may be certain scenarios where you might want to consider vitamin D supplementation through an over-the-counter supplemental vitamin, especially during those winter months for your child. And you'd want to be just reading labels and making sure that you're picking something that would specifically supply back that vitamin D that's missing during those winter months. And if you have any questions about that too, especially questions that might be specific to underlying issues that are unique to your child, a conversation with your pediatrician would definitely be appropriate.
Yeah, I was going to ask about that because, you go to the pharmacy and, you see like an entire 2 aisles maybe full of supplements and they look appealing and there's gummies, so many different flavors and targeting towards kids. Like, is it best just to talk directly to your pediatrician about like which ones make sense and then for what ages too?
Yeah, no, that's a great point, Kristin, too, because it is age dependent as well. There is a specific need, for example, to think about vitamin D supplementation for infants who are exclusively breastfed. So that is something that pediatricians are always reviewing with parents, especially parents of newborns and infants. So I think if you do have concerns about your child's, maybe their food preferences, maybe you really, really struggle to provide them with a balanced diet for a number of different issues, then I think a conversation with your pediatrician would be completely appropriate, and discussion about which vitamin options, if they're indicated, might be best for you.
Perfect. Thank you. Okay, so we are, like I said, we're close to February. We are getting close to February, and that in our house, my 2 daughters count down to February break. So that is a great sort of segue into some of this next form of questioning, which both, I would love for you both to just kind of jump in and weigh in, and let's just make it conversational. But traveling, whether you're going for a longer car ride, in my days, it was, there was nothing. It was just me and my brother in the back seat for, any 10 hours or 11 hours. That's just what you did. But now it's more about like, again, what do you bring with you, keeping your child occupied. I think Dr. Rich has said in the past that we need to bring back boredom, and I agree with that. But that's maybe a different webinar. But can we talk a little bit about how to best prepare, maybe with younger kiddos too, maybe to start, for traveling, what are some of the things to consider, whether it's in the car or whether it's going to the airport. There's been a lot of challenges with travel and a lot of delays, a lot of like horror stories that you've been hearing about, and lots of cancellations. So could you both just sort of weigh in on like, also maybe this is for the parents too, to how to keep their sanity and how to manage this?
So I can start and then, throw it over to Dr. Moffitt.
Yeah.
So it's a great question, because it is true. Like, one of the huge pros, I think, of where we are right now, just around the world, is that we're starting to travel again. People are kind of getting back into their usual rhythms. The idea of like going somewhere on February vacation is becoming something that's just thankfully more of an option for folks. And what I would say is that boredom absolutely is the hardest thing. And I think, Dr. Rich is right, because it used to be that kids were like, if I was bored, I would be really bored. Maybe I would go bother my parents for a little bit. Maybe I would, just sit there and be really frustrated. But eventually I would just have to find something to do. But again, when I think related to our screen use, like now there's always something that could be filling in even like 30 seconds of boredom. And so it gets a lot harder, especially with our little ones, where we're like, why don't, maybe we're going to be at the airport for a long time and I can't just necessarily put them on the iPad. And I could, but it's going to cause a lot of problems for me later. I don't necessarily want my child sitting on the iPad for like 4+ hours or something like that. I think variety really helps, especially with our little ones. So like, I know it's hard because again, parents, you end up sort of being pack animals, where you're like, okay, well now I need to bring a whole extra suitcase just of things to try to keep my child busy. But variety helps, right? So I know one trick that parents often rely on at the airport is like, okay, I've had these things that I know my kids used to like, and they got shoved in some closet somewhere, or they just like forgot about them. And now I'm going to bring those out when we travel, because again, what's old is new again, right? So kids forget that they had this thing, or even if it's something that's they're a little bit past it developmentally, they're like, oh, this is fun because again, it's novel. It's like something I can do. And I think that's portable. They make these little portable, like sort of board games. They make a lot of portable, like coloring and activity sheets. What is it that I can get my child to do, even if it's like, okay, I have to string together a bunch of activities that they're only going to do for 20, maybe even 30 minutes if I'm lucky. But then, we've kind of got something new for them. Sometimes kids, if we're lucky, will also nap for some of the travel time. And then, always, even parents, you're so well prepared anyway, but really kind of get ahead of opportunities for your child, maybe to like give you a hard time when you're already stressed and exhausted with like the chaos of traveling. So making sure, you've got enough snacks, making sure they've got like their lovey or whatever it is that is going to be kind of soothing for them. If your child is old enough, asking them, are there one or two things, within reason, no one's bringing like the giant dump truck on the plane, but within reason, what are one or two things that you really want to bring, that you want to make sure that you have on the plane? Because then they've already like kind of chosen for themselves, like, this is something I'm willing to play with, hopefully again for at least 20 to 30 minutes. But I think variety often is something that parents find really helpful, and lots of snacks, lots and lots of snacks.
That's a great point. Dr. Moffitt, do you have anything else to offer? I would say lots of snacks too.
Yeah, no, snacks are key. My kids always love the opportunity to actually go to one of those stores at an airport, for example, and pick out one snack. That would be a great way. You can take 20 minutes to fill time with that. I would just add from a health perspective too, and this is really, I would say, unique to airline travel, especially given what's been happening for delays. If your child has specific medicines, for example, that they need, I know the temptation lately, if you're planning on checking a bag, is to put as much as you can in that checked bag, so that you don't have to deal with it and be worried about that you're getting onto a plane in addition to yourself and your child's luggage, etc. I would just be thoughtful about any medications that your child may need on a regular basis, and maybe thinking about putting those in your carry-on bag instead. And this would include your own medications as well, just for those unfortunate events which are happening where, you hit the ticket desk and you've checked your bag and your bag is off, but then you do end up with an unforeseen delay, and you'd want to make sure that whatever medications or anything else that you or your child might need would be on hand and still available for you. So, hopefully it's not too bulky and it can fit in what you were planning to use as a carry-on anyway. But that would be one thing that I just put a little extra thought into when you're packing, in terms of what will physically stay with you and what might go through with a check bag. And otherwise, I'm still encouraging masking in airports in particular. If people are able to comfortably wear a well-fitted mask, obviously that's going to be age dependent as well. And that is really relevant right now in the context of what's continuing to circulate for respiratory viruses. We are seeing drops, luckily, in RSV rates, influenza rates, and currently even in COVID-19 circulation rates. But we know that this is in flux, and we might even be expecting a second surge of influenza. A typical influenza season actually has two peaks. One that's typically with influenza A, which we feel like we're on the downswing of, but that we saw a ton of in November and December. And I think it's also fair to say that we just really don't know entirely what COVID-19 variant might be coming next as well. So in addition to those two viruses, there still are plenty of respiratory viruses circulating. And even if you're at a position where you've had every vaccine that you can, you otherwise don't have underlying conditions that put you at risk, or your child at risk for severe infection with any of these, it just would be a bummer to get sick while you're traveling. So one of the places where you might be most likely to become infected would still be places where you're surrounded by a lot of people in those security lines, for example, shoulder to shoulder with other individuals indoors in an airport setting. In those settings, I'm still recommending mask wearing for those settings in particular.
So for the busier settings, let's say you're gonna get on a 6-hour flight and with your two kids, would you recommend intermittent use, or what do you suggest for long flights?
Yeah, for long flights, I'm actually still recommending masking as well, as long as it's something that you and your child could do comfortably. And, taking your mask off during a flight to eat or to drink is probably fairly safe. We learned a lot about respiratory viral transmission actually in an airplane cabin, especially during flight, when the air exchange happens at actually a high enough frequency that the transmission of respiratory viruses tends to be lower when you're actually in flight. So for the actual in-flight time, removing that mask to take a drink, have something to eat, completely reasonable. But the transmission is not zero during those flights. So, and it all depends on who's sitting next to you, how close they're sitting, and things that you don't really have control over. So I'm still recommending, during the current phase of where we're at, not just with COVID-19 transmission, but with other viruses, wearing a well-fitted mask if you can do so comfortably in the airport and during flights, to whatever extent you can.
Terrific. That's really helpful. Thank you. So at this point, believe it or not, we're going to move to the live Q&A section. So I mentioned at the top of the webinar. Please continue to check back in our Answers Hub because we do update a lot of this content, daily. So we're constantly refreshing. So the content that you're hearing today from our two experts is oftentimes we are sharing a lot of that on our hub and also on our Instagram and our Facebook pages, which you can also follow. So there were a couple of questions that were submitted in advance. And Dr. Lee, you did talk about this at the top of the webinar about seasonal depression. So in terms of the best therapeutic approach, maybe you could just do a refresher, because I think there's been some new people that have joined the webinar. Just a quick refresher on, what is the best therapeutic approach if you do see that your teenager is dealing with some severe seasonal depression. I think you talked a little bit about CBT.
Yeah, happy to. Thanks for the question. So
Mhm.
cognitive behavioral therapy, which is typically, in the field, we love our acronyms, so often called CBT, is sort of the gold standard evidence-based type of therapy for treating depression. So even though seasonal affective disorder, we think of it very specifically as this depression that occurs, again, sort of in the fall, late fall and winter months when we have less access to sunlight and the days are shorter. So it has this seasonal pattern to it that we talked about earlier in case folks missed that. It is still, depression, right? We're still experiencing episodes of depression. So we're having low or irritable mood, our energy is lower. We're not as interested in doing things that we normally like to do. We're maybe being overly negative or overly hard on ourselves. We're isolating, right? So maybe we're having difficulty concentrating, we're eating or sleeping a lot more, a lot less than usual, especially with sleep. It's typically that we're sleeping a lot more because we have a lot less energy when folks experience this pattern of seasonal affective depression. And so cognitive behavioral therapy is really focused on this idea that the way that we think about a situation or how we interpret what's happening to us is strongly linked to how we feel about it. And then how we feel about it is linked to how we behave. And so in CBT, you're really helping kids kind of understand that there are these three components, right? That being depressed actually has to do with not just how you feel emotionally, also has to do with how you feel physically, but also how you're thinking about situations or interpreting what's happening around you, and then how you're behaving in your everyday life. And if we kind of understand these three components and how they're all connected to each other, and how, actually you can learn to change the way that you're thinking about a situation in order to kickstart a more positive, feeling better and then doing better cycle. And that in and of itself becomes reinforcing. That if you're able to do that can actually go a long way towards easing some of these depression symptoms. So for those of you that, have children or teens where you notice, even if you're just noticing your kids get depressed at some point in the year, and it's not something that goes away, it's not a short period of just kind of feeling down or stressed, or something happens in your family or at school or with their friends that really seems to be driving how they're feeling. If it seems to be going on for, let's say it's like, most of the day, nearly every day for at least say 2 weeks, then you probably want to talk to your pediatrician and say like, hey, here's something that's going on with my child. Like, do you think it would be helpful? Do they need more support? And let's kind of continue to monitor and think about what the best treatment plan would be for them. So it's not just for kids who have the seasonal affective pattern to their mood changes, but it is the gold standard intervention for both CBT.
Yeah, that's really helpful. And then we actually just had a question live that just came in. That's connected very much to what you were just talking about. Are antidepressants effective in treating seasonal affective disorder? What is your take on that?
So I want to be mindful. I am not a psychiatrist. I know it's very annoying because the names of our jobs sound very similar. So I'm a psychologist, so I'm not a physician. So I just want to put that caveat out there. So I don't prescribe medication, which I'm grateful for. I have wonderful expert colleagues who take on that job. That is not something that I do. But yes, I've worked with a number of patients, and I know, my understanding from what I've heard from my expert psychiatry colleagues is that antidepressants, and sometimes it's not just antidepressants, sometimes we need to think about what the specific medication regimen is that makes sense for your child and your family. But medications absolutely can be helpful at easing symptoms of seasonal affective disorder.
Oh, terrific. Dr. Moffitt, another question just about supplements and helping to ease with seasonal affective is vitamin D dose supplement. Could you elaborate a little bit on that, specifically maybe for like the younger population? Is that also acceptable in helping with seasonal affective?
So I think the question might be referring to whether or not vitamin D supplementation is a treatment for seasonal affective disorder. So I am not fully aware of any studies that have been really kind of head-to-head and well-controlled clinical trials that have really given us very strong evidence that in and of itself, without other added therapies and interventions, that vitamin D supplementation in and of itself is an adequate treatment for seasonal affective disorder. So I'm not sure I would rely on that alone for treatment of seasonal affective disorder. I think that because of how multifactorial the contributors are to the development of the symptoms of seasonal affective disorder, I think having a well-balanced diet and adequate levels of vitamins and minerals are probably play a role in, if you're really deficient in any of those vitamins, it could certainly contribute to increased fatigue or decreased energy. That could all play a role in the development of seasonal affective disorder. So really doing doing your best to maintain a well-balanced diet and ideally maintain adequate doses and intake of the recommended vitamins and minerals would be an important component of hopefully preventing seasonal affective disorder. But vitamin D supplementation in and of itself to treat it is not something I'm totally aware of.
Got it. Okay, I'm going to keep you because a couple of questions about the fewer options at the grocery store. So a live question about that. So would you recommend frozen fruits and vegetables for babies between 6 and 12 months?
Yeah, frozen fruits and vegetables are still a great source. They're depending on the vitamin or the mineral, there may be a bit of a loss, and depending on how the product is frozen, whether it's flash frozen, etc., there may be a bit of loss in the ultimate in the overall mineral or vitamin content. But really, a lot of that those advantages of the vitamins and minerals are still maintained even in frozen fruits and vegetables. So they would still be a great alternative, especially mixed up and blended in whatever ways to make it flavorful for a toddler or a child or even an infant. Those would still be really good sources.
Another live question, it's hanging on the vitamin D topic. So my son is lactose intolerant, but he's also on ADHD medication. What are some potential options for him to supplement vitamin D?
Yeah, so lactose intolerance, being vitamin D is also found in egg yolks. So I don't know if he likes eggs, but eggs would be one good source. The other major sources are things that kids don't typically love, such as the oily fish and liver. So it can be one of the tougher vitamins to supply through nutrition. This is another scenario though where the activation of vitamin D happens through exposure to sunlight. So yes, the sun strength is not as strong right now, but getting your child outdoors and having some exposure, even if it's just on the face because the rest of him is covered, to sunlight would help to boost some of the activated natural vitamin D as well. And then beyond that, this might be someone for whom you would consider vitamin D supplementation, which really, again, the majority of comprehensive vitamins that are provided for children as gummies and pediatric vitamins do include vitamin D, and they typically provide the recommended daily allowance as well. So that is something that you could look into in terms of a potential source, especially during these winter months for vitamin D supplementation for your child. And I wouldn't hesitate to discuss that with your pediatrician as a possibility as well. There may be a specific vitamin that your pediatrician might recommend too, based on other facets that might be unique to your child's medical history.
No, that makes sense. So Dr. Lee, just in terms of getting your child's, your child or your teen up and out, and maybe even interacting with other teens, I feel like a lot of times now, like you mentioned something that was really interesting, that they confuse real life interactions and and virtual interactions as being the same. Is there advice on like why like real life interactions maybe boost more of those important feel good chemicals? Could you give some examples of maybe some suggestions for parents of teens on how they may be able to get them out of their rooms, socializing separately on a screen, and maybe how to get them out with their friends, because we know that does help with boosting mood?
Yeah, absolutely. So I don't know if there's research showing sort of what happens, biochemically when we're in person versus virtually. I think we can definitely get some of those feel good chemicals. Again, a lot of screen time is very reinforcing. This is why it's so addictive. We all love that now everyone's attention span is shorter because we're all used to these like really brief TikTok videos. And so, and they're very entertaining, but it's very easy for us to just kind of keep getting those quick hits and not sort of notice that it's harder to sort of sit still for a longer period of time or actually like engage in a conversation. But I think one of the things that, one thing that naturally actually happens for kids that's helpful in regard to the sort of like live in-person social interaction, especially now that we've moved out of the phase of COVID where we really sort of by necessity had to do a lot of remote learning, is that kids are being forced, like they're not able to just be on screens, right? I mean, they're like, that's like a very, very small proportion, I think, of kids now who are able to just say, I'm able to do sort of everything virtually. Like I do have to interact with people, whether that's just my own family members or my extended family or my neighbors. You know, if I'm going to school and if there are activities, or if like I have a job or I'm doing something after school, I'm sort of by necessity having to be around other people. And again, having that conversation with your kids, if you're noticing your kids are not necessarily, you know, oh, it's kind of, you know, I'm scared of it, because sometimes kids are, they're sort of scared of in-person interactions, and that causes a lot of anxiety. Some kids have what we actually call social phobia or social anxiety disorder. But, you know, there are a lot of kids who might just sort of be subtly avoiding it, right? So you sort of notice like, oh, my kid sort of, you know, doesn't want to do as much in person, or when we have to go do something in person, either they try to get out of it or they start to look sort of more stressed. And so having that conversation with your kids of like, what is it like, do you notice any differences of like when you're talking to your friends, or like, you know, playing video games with other kids online versus what is it like when you're in person? And actually, let's think about that, because it actually can be a little bit stressful, right? Many people, even if they don't meet criteria for social anxiety disorder, get a little nervous when they have to do things in person, especially if it's people that they're less familiar with, or where they're going somewhere where they don't know many people, or especially for kids when you have to do something in front of other people, right? So I talk to a lot of kids about, you know, different performances they have to give. So they're in the musical, they're in the choir, they're, you know, playing an instrument, or they want to be in the school play, and they love that. But also, I mean, it is really scary to be on stage with everyone sort of staring at you. And so sort of thinking with them like, okay, if you have these goals, like what motivates you? So if you have these goals of, well, I want to be able to, you know, play this sport. And so I don't really love like talking to people live, but I want to be on the lacrosse team, or I want to play basketball, or whatever it is. What's going to help you get there? What's going to help you get there and feel less stressed about it? So we have to practice, similar to anything else. Like if we're getting used to practicing a lot of interaction virtually, we also need to get used to practicing what is it like to be live with kids. And maybe we start with kids that you know or you feel more comfortable with, whether that's kids in your own family, whether that's, you know, cousins that you maybe don't see quite as often, whether that's other kids in the neighborhood, whether that's, you know, if you have some sort of like spiritual activity in your life, maybe, you know, that's a community that you're a part of. Like, where do you want to start? And let's kind of actually, and sometimes we do need scaffolding from parents. I think this is maybe what you're hinting at, Kristin, is like, what if they're not motivated to do it? Is like, maybe we need to set some things up. Again, starting with someone that you're more familiar with, or that you feel more comfortable kind of pushing the envelope with, and then gradually moving towards kids that you might not know as well. And again, pulling on what are kids' goals. I really want to be, you know, good at swimming, or I really want to take, you know, this kind of like art class, you know, at the community center on the weekends. Okay, well, what's going to help you kind of get there and feel comfortable doing it? So a lot of it is actually just about practice. You know, I think this is true for adults too. The more we do something, even when it's hard, the easier it gets, until we're like, why did I think that was hard to do? It's just about exposing kids to kind of doing things and doing it in a gradual way where they feel really safe, even if they're a little bit uncomfortable.
Yeah, and the key word is the motivate, because we had just another quick live question that came that said, I have a 9-year-old boy, he's doing great in school, but I have the worst time getting him up every morning. So especially in the winter months, you know, it's darker, it's gloomier, you know, any advice or suggestions on how this mom might be able to like motivate to get up?
It's a fantastic question, and I'll tell you, whoever this parent is that asked it, that you are not alone. I hear this from a lot of parents. I know many of us know this from our own experience, and this is a very common problem. And I like, Kristin, that you point out too, like the winter, like who wants to get out of the cozy bed? Like also not me. So I get this. Again, I think maybe a little bit of detective work could be helpful, right? So, you know, for this mom, or for or this parent, or any other parents that have this question, you know, what do you think is getting in the way? And can your child identify that? So for example, is it something where it's like, I just don't want to get out of my cozy bed, and so what can we do to motivate you? Is it actually something where it's like, I actually don't want to think about going to school because there's something specifically at school that stresses me out? Do we notice it happens on certain days and not others? What is it actually like, oh, I have a hard time doing something in my morning routine that stresses me out, it gets in the way? You know, so am I not getting enough sleep, right? Am I going to sleep kind of too late, or I'm not sleeping well? So even if they're going to bed at the time you want them to go to bed, but actually their quality of the sleep is not great. So maybe doing a little bit more detective work, if you don't already know, of like, what do I think is getting in the way, and actually making it hard in the morning, and having that conversation, you know, with your son of like, what's making it hard to get up in the morning, and what do you think would make it easier? Some kids, you know, appreciate like a visual schedule, like kids who are kind of like disorganized, or you notice they're just always going to kind of drag their feet on like everything, and getting out of the door in the morning becomes a major hassle, especially if you have more than one kid, and now you're like, we're all going to be late. It's very stressful and hectic in the mornings. Nobody likes this. Some kids appreciate having a visual schedule, like, okay, mom or dad wakes me up at this time, then I do these things. And it could be simple things, they know how to do. Like, it's just a checklist. Like, I get up, I use the restroom, I brush my teeth, I get dressed, and I come downstairs for breakfast. And then, here's my bag's already packed and I'm kind of out the door. Some kids, if the motivation is really low and it's like they just don't want to go to school. And again, we get this, like, we've all been there. We had days we don't go to school, we don't want to go to work. You might need a little bit of a motivation system. So you could think, even for the short term, like, let's set up a little bit of a chart for you where, like, if you're able to go to school and follow your visual schedule or routine in the morning, this number of times, then you're going to earn this, like, small reasonable reward. And I always say reasonable parents, you do not need to promise, brand new, like, expensive sneakers or a trip to Disney World to get your kids to do these things. Have a conversation with them. What was something small that they'd be willing to earn, some kind of privilege or a treat or something, and then see once they get into the habit. And again, as the days get longer, it will get easier.
Yeah, no doubt. And so we just have another minute, but one last question for Dr. Moffitt. In terms of families that want to try to balance, to give their kids that healthy childhood, everything what they need, right? But they need to keep themselves safe because of an underlying condition. What are some of the things that they can do? They say that they still mask, but they're in the minority. And how reliable are those home testing for gathering with others? What are just like one or two suggestions you might be able to give this family that's like, look, we want to give our child this healthy life, but we also want to make sure we don't put ourselves at risk?
Yeah, I think that's a great question. And it's such a unique perspective for every family who has to consider where the adults in the family are coming from in terms of their own risks, and where the children might be coming from. And then you have to take on, the risks of what everybody in that family does and what they're exposed to on a regular basis based on what their routine includes. But I think that, and a bit of this is age dependent too, but I think if you are a family with household members who are maybe at increased risk for severe infection from any respiratory virus or any infection whatsoever, depending on the age of the children in the household, just making sure that you've had very open conversations with them about why the importance of preventing some of these infections is different for your family than it might be for other families. Just to, and again, a little bit of that is going to be age dependent. It's much harder to explain to a 2-year-old or a 3-year-old. But using language that they might understand and trying to frame it in ways that they might understand that I realize that, all of your friends in kindergarten aren't wearing masks to school anymore, but so-and-so in your house actually could get really, really sick if they were to get an infection that otherwise might not make people really, really sick. So we're going to try and keep that person as healthy as possible, kind of framing it in ways that are age appropriate, that they would be able to understand. And then beyond that, I think it's also kind of having that circle of people around them who you really consider close to your family. This may include your child's school support system and teachers. This may include a closer circle of friends and family, but really making sure that there's an understanding for those people who are kind of in your closest circle of contact, that everybody's on the same page in terms of why this is important, so that everybody's kind of endorsing the same message for that child. And then the question about home tests still are really, none of them are 100% sensitive at detecting an infection, but they still are a very, very good tool that we have, particularly if we know we are coming into an event where we're going to be indoors in particular, with people who may or may not have, hopefully nobody with symptoms of a respiratory infection is attending this indoor event. You could certainly ask that they don't. But I think that in terms of using those as one more added piece of protection and asking that people that are going to be gathering for that indoor event do a test and confirm that it's negative the day of getting together, it will reduce the risk even further, not 100%. But reduce the risk even further that, at least for COVID-19, which we have home tests for, the likelihood of being infected during that gathering is very low.
Yeah. And just stay home if you're not feeling well.
Stay home if you're not feeling well.
Just stay home.
Yeah.
Well, thank you both so much. This was a really great hour. I feel like I learned a lot too. And thank you for everyone who joined. And if you have questions or your questions weren't answered, please come back and visit our Answers Hub. Follow us on Facebook and Instagram. We're always sharing a lot of content. There's a lot of parenting resources as well that you can find online. But thank you so much, and I'm sure we'll do this again. Thank you. Have a great afternoon, everyone. Be safe in the snow this afternoon.